How can you implement this? We did a study we published in 2013 in the Journal of Clinical Pediatric Dentistry. We had an IRB approved study with 30 kids in each group. These were kids with extreme caries rate. And we had to prove to the institutional review boards the cavities had to be big. So these kids came with these really big cavities and were divided into two groups. And one group used Evora Kids, which was an earlier product from Origenics, which included the Strep ubera, Strep oralus, and the Strep rati. At the end of the study, we had significantly reduced the levels of mutant streptococci, and we were extremely pleased. Even the level of lactobacilli dropped in the level with the Evora Kids group. What is most interesting is I then later got permission to do a retrospective study, and 3 years later we brought back 54 out of the 60 kids, and only 4 of them remain caries prone at all. The others all became either caries resistant or caries immune. This was a huge change in their microbiome. And that was all from a one-time course of ProBiora, one of the predecessors, 3 years earlier. So I tell people all the time that the best thing we could do for public health in this country, the best thing we could do for public health in all countries to prevent this rampant early childhood caries, which by some estimates is like 70% of the child population in developing countries, okay? It's huge. There's billions and billions and billions and billions of cavities in kids out there causing many, many infections, pain, all sorts of issues. The best thing we could do is use a probiotic to prevent this. And of course, ProBiora Pro is what we use in our practice. We do a lot of probiotic care in our practice, and we advise people on the importance of many things. Changing the microbiome by diet, very important, by probiotics.